So if you're listening to us for the first time, as you know, I'm an ENT doctor, but also a patient advocate. I'm here to help you better understand the changing landscape in the world of healthcare. And back with us today is CindiGatton, who's made patient advocacy her life mission now. Welcome back to the show, Cindy.
Thanks, Dr. Gallups.
You have a special guest today. Tell us about her.
I do indeed. A client of mine, Simone Rosa, is joining us this morning to share a little bit about her story with her father and our very fragmented healthcare system.
Well, Simone, welcome to the show. Glad to have you.
Thank you.
So tell us your story and how Cindy has helped you.
The short version is that my father suffered a traumatic brain injury back at the end of March and wound up in the emergency room getting treated for a brain bleed. After 37 days in the hospital, he was urgently moved out of their facility to a, what was it called?
A rehabilitation facility.
Yeah, and the other word, I forgot.
Subacute is the word that we use.
Yes.
Subacute. And they sprung that on me with about 48 hours notice and gave me a list of a couple hundred facilities around North Georgia and told me to pick one.
Oh, so it was up to you at that point.
Yes.
Oh, by the way, we're discharging him.
Yes,
No,
precisely.
Did you think, what struck you about this discharge? Was it that it was so abrupt? It wasn't able to go?
Well, they did this twice. The first time, it was extremely abrupt, and they were attempting to discharge him to a facility that I thought was unprepared to deal with his the level of care he needed at that time.
Yes. So you felt that that they were making decisions not in his best interest. Why would they do that?
Well, as far as they were concerned, he had gotten over the initial trauma and was stable, and he needed to go to rehab.
Okay.
And then the day after they told me they were discharging him, and I was fighting that discharge, that's when he wound up in ICU in a comatose state.
So how do you go from discharge to in the ICU?
Good question.
Yeah.
Somebody swapped out his IV fluids and his sodium bottomed out. The next thing I knew, he was comatose for 32 hours.
Well, that'll do it. As a doctor, I understand that. Mm-hmm. So again, medical errors are a big issue. Why would they, even prior to that discharge time, as a doctor, you make assessments. I mean, you felt that he wasn't ready for discharge.
Correct.
What? I mean, other than medical reasons, were there any other reasons why they were discharging him?
Well, they were doing a very poor job of explaining the process. Well, they didn't explain the process. Let me put it that way. The understanding I have now, thanks to Cindy's help and a lot of research, is that they had medically stabilized him, but recognized that he needed physical therapy to regain the strength he had lost.
And that's not uncommon. That's true.
I understand that now. Nobody was telling me that then.
Wow. So a big miscommunication, or really no communication to you.
Right.
Felt.
And he had been able to walk, albeit with difficulty, when he got to the hospital. And by the time they tried to discharge him the first time, he was unable to walk. So I was fighting discharge because they were trying to send him to a place that I thought was not safe.
So you were faced with several challenges, medically and financially.
Yeah, but the finances were not top in my mind at that time. Mm-hmm. Although I did keep wondering what I had signed to admit him to the hospital.
Right. So, Cindy, pretty common in your practice of patient advocacy?
Sadly, too common. I think the failure of us as lay people, it's not our failure, but the failure of institutions to communicate what's happening, how they're making these decisions, and they are made often in what feels to us as consumers in a very abrupt way with very little time to plan. I mean, getting a list of 100 facilities and saying, pick one. This is, your loved one needs to be discharged and they've got to go to one of these facilities. And by the way, not all of them may have beds. They may not have, as Simone pointed out for her father, they may not have the right kind of setting based on other issues that he was dealing with to care for him. It's very complicated.
Years ago, when I was training, even at the VA hospital here in Atlanta, and at Emory University, they had social workers who were advocates for the patient. Were you introduced to a social worker?
I finally spoke to someone who was identified as a social worker. I would not call her an advocate for my father. She seemed to be in the role of helping me understand the need for discharge, but not necessarily providing a lot of guidance as to where I should be looking until the second time they tried to discharge him, which we ultimately moved him out of the hospital then. And that time I dealt with a different social worker who did at least spend 10 minutes walking me through the list of 100+ facilities and crossing through the ones that she would not recommend and highlighting the ones.
That's what I would expect. And as a healthcare consumer myself, I've dealt with that. So I really can empathize with the patients. It is a whole new realm. I mean, we think about healthcare almost daily. It's in the news. It's about how we're going to have to be more responsible for it. But I don't think the common listener, anyone out there that's not involved in medicine, and even if you are, it's new water, can appreciate the anxiety for just the whole family and the process. And now, with the onset of Obamacare, we have another item we're going to have to deal with, and that is hospitals now are going to be held accountable for any readmission within 30 days of discharge of a patient. Right? And what's really neat about this, I don't know if it's neat, but it is what it is, if they send a patient to a rehab facility and the patient leaves the rehab facility and goes back to the hospital, it's not the hospital who's going to pay the fine, it's the rehab facility that's going to pay the fine. Don't think it'll ever happen. I really don't. I don't think anyone will ever pay those fines. I think they're going to go away. I think with the stroke of a pen, Obama will get rid of that too. But it is about accountability. It is about making sure the healthcare system works for you. So what ultimately happened with his rehab?
I had to move him from the first facility. His medical condition declined, and the facility didn't recognize what was going on, so they just decided they were discharging him to long-term care because they felt they could no longer help him improve.
And when you say they, was it a whole team of experts that sat down with you? And
I wouldn't call them experts, but yes, a team.
Right.
There were about 10 of them in a room in a care conference explaining to me why they thought he had plateaued in his care. And when I finally found another facility and moved him to that one, the first thing they did was a series of tests and identified that while his sodium was still level, his potassium and magnesium had bottomed out, which was the cause of the sudden weakness and the personality change. He had become belligerent and was refusing to participate in rehab.
I find that people, I know I'm an ear, nose, and throat doctor, but I am a doctor, believe it or not. And even I listen to the story and go, okay, I could even manage that.
Yeah.
Now, so, it's about not just one thing that happened to your father. It was a series of things. And listen, you're a nice lady. I'm sitting in front of you. I'm talking to you. You're smiling. But, there's a lot of frustration in your voice. And tell me, what is it about this experience that really gets to you?
There was a couple of things. The first is that I walked in to a situation that I didn't know much about, wasn't prepared to deal with, and was put in a position to make a lot of immediate decisions uninformed. The people that I was dealing with at these facilities, whether the hospital, the rehab facility, were not providing me what I would call good information to make a sound decision on. So I had to get myself educated fast.
And that's how you found Cindy.
Yes. Yes, it is. And I also felt that the need to be informed, my need to be informed as my father's advocate in a couple of cases was the only thing that kept him alive. And nobody should be put in that situation.
Totally. Cindy, you see this situation often then?
I do, and I think there's one other aspect to Simone and her father's story that I think is really important, is that they actually had addressed what I call the hard conversation, which is how do you want to be cared for if something catastrophic like this happens to you?
Yeah, you have to be prepared. You
They
have to have a
addressed it.
plan.
They addressed it, but what they hadn't
talked
done
about it.
or talked about it, they had the talk, as I would call it, but they hadn't codified it. So her father didn't have an advance directive. There wasn't a power of attorney. So at the point where he really wasn't able to handle his affairs, it became very challenging for Simone to navigate that system without having the proper documentation.
So, the last quick words of advice, Cindy, for consumers.
First thing, have the talk. Really think about how you would want to be cared for and share those feelings with your family members, but then codify it. Take the time to do an advance directive, share it with your physician, share it with your family, do a power of attorney so that it's there to help your family help you.
Excellent. Well, Cindy, thanks for joining us again. Simone, thank you for taking this time with us.
Certainly,
We really
thank you.
appreciate it. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.